His hair coiffed. He's a cardiologist with SLU Care and SSM Health.
But no bow tie.
SLU Hospital. Good morning, Dr. Michael Lim. Welcome back, Big 550 KTRS.
Good morning.
Let's talk about this lower cholesterol drug, these new statins.
Statin drugs.
Statin drugs.
Statin.
Absolutely.
I knew it, and then somebody told me the wrong word, and then I blew it again.
There you
Statin drugs. Yeah, so what's going on with this? There's a lot of talk over the years about all this stuff.
A lot of talk. So, earlier this week, the American Heart Association had their annual meeting. Usually a lot of stuff comes out from that meeting and another meeting in the spring, looking at where we stand from a cholesterol standpoint, heart disease standpoint. Two different things I think very important from a statin standpoint. Number one, if we look over the last 20 or so years, the number of people on statins has increased dramatically. About 80 to 90% increase in an overall number of people on statins and prescriptions written for statins over that time period. Kind of representing the fact that we've gotten more and more comfortable with these medications, and that study after study after study, even going back almost to your 1900s, has shown that these things work. And how they work is they prevent heart attacks and they help people live longer. The cool part about that study is it actually showed that the overall out-of-pocket costs for patients over that same 20-year period went down significantly because these drugs have gone generic. Yeah,
so lots of things to digest here. So the drugs are lowering the cholesterol.
The statin drug is aimed and targeted to lower bad cholesterol or LDL cholesterol. So it'll take an LDL cholesterol of somebody in the 100s and bring it down. Depends on the dose and the type of statin used, but potentially could bring it down 50 to 60%.
Is it a license to go do anything you want if you take these drugs? Like, I can continue the lifestyle that got me this high cholesterol in the first place, but I can take these drugs and I can continue on?
There's always very interesting ways to look at that in terms of, well, if I'm taking this drug, that means I can eat not necessarily as healthy or maybe not be as physically active. I think the more difficult thing to quantitate is lifestyle. And there is a growing body of evidence that taking a medication is not a surrogate for a poor lifestyle. You got to do both.
Yeah. And I would think the goal would also be be able to wean yourself off of those and do that healthier lifestyle, and hopefully not be able to have to use them for many years.
Yeah, that's a great point, and I think that is our natural thought is, and it's the same kind of thing we think about in terms of like blood pressure medications and that type of thing. We say, wow, if I get more physically in shape and I start exercising all the time, I can get off of these. And the interesting thing about statin medications is we probably don't think that that's the case. There is a concept of trying to lower bad cholesterol, LDL cholesterol, but we do believe that there are other things that these drugs do outside of just lowering bad cholesterol to prevent a heart attack. And so even if you improved your lifestyle, and so you now start running 5 miles 3 times a week, and you've changed your diet remarkably, so those are all great things. It doesn't necessarily mean that you should come off the statin medication, because really what you're doing is you're kind of throwing away one active mechanism of trying to prevent that heart attack down the road.
This study also points to, at one point the U.S. was spending $7.6 billion in these drugs. Now we're spending $3.9. So that's almost cut in half the amount of money we're spending on more drugs.
Right, and this lends itself toward this concept of, I guess, capitalism,
right.
And the laws that exist in this country. And so when drugs come out and they're brand new, there is a lot of times a sticker shock because they're brand name, trade name drugs, and they do have higher prices. When that patent wears out and these drugs do become generic, and then I'll add the caveat, if more than one company is making those drugs,
right.
The price can come down because there's now competition. The problem is with generic drugs, as we've kind of discussed a couple times before over the months, if there's only one company making it and the drug's generic, it's still basically an exclusive product. And
right.
So the price doesn't have to come down.
Cholesterol, is that family? Is that genetic, or is it lifestyle, or is it both? Or
yes. So it's both. And so the other thing that came out this week was new recommendations from the U.S. Preventative Services Task Force, basically saying people in between the age of 40 to 75 who have not had a heart attack before, have not had stents, who have not had bypass surgery, there still are indications and reasons why you could benefit from being screened for what your cholesterol is and what your risk is, and potentially benefit from being put on one of these medications even at the age of 40, if your risk is higher. And that risk is translated based on genetics, based on some of your other lifestyle things that you have, like diabetes, hypertension, smoking, lack of physical activity. And when your risk is higher, you could benefit from these medications. And so the recommendation is for those 40 to 75, have this conversation with your doctor or have a conversation with a cardiologist and saying, hey, I don't want to have a heart attack.
Yeah.
What can I do?
Dr. Michael Lim, best cardiologist with SLU Care and SSM Health SLU Hospital. Doctor, always a pleasure. Good to have you in here.
Thank you.
824, Big 550, KTRS. Have some medical